I'm Dr. Jennifer Jackson. I'm a registered nurse and assistant professor in the Faculty of Nursing at the University of Calgary. This is a quick video on how to write up your qualitative findings. So I am organizing this video on the principle that you have done your analysis, and while writing and analysis are not necessarily separate points in qualitative research, I'm going to assume that you have some themes and you're ready to write them up. You also have some quotes that support those themes. So this is how, as a qualitative researcher and a prolific reviewer and also a journal associate editor, this is how to write up your qualitative findings so they are really clear. Sometimes I see things where people will put 2 or 3 quotes in a row. I will also see where they give an introduction and then put a quote and just leave it. And this is a very risky strategy, because if your quotes are just there and you want the person reading to interpret them, you run the risk that they will interpret them differently than you do. So when you write them up, you need to write them in a way that you lead a person in a direction such that they come to the same conclusion you did, and you provide them the information they need to know so that they come to that conclusion. Now, it doesn't mean that they're necessarily going to agree with everything, but it's more about like, yes, I see where this is coming from. So there are different conventions for different things, like an ethnography is written up differently than a grounded theory is. But in general, there is an approach that I find works very well. It took me a long time to learn this, so I'm going to try and make it very clear so that hopefully you will suffer less than I did. So you introduce, you provide your quote, and then you explain and analyze what the quote means. So the introduction, you're setting up the reader so that they know what the quote is about. What do you want them to see about where this is going before you give them the quote? Essentially, how do you give them the information they need to know to interpret this the same way you did? Then you provide the quote, making sure you give the participant number or pseudonym or whatever the case may be. Then after, you have a sentence of explanation, which is where you tell the reader what the participant means by this. And to do that effectively, you do not repeat the words in the quote. So when I did this badly, I would rewrite, if the quote said something about meet me halfway, the participant, I would write that this participant is talking about meeting her participant or her patients halfway on this thing. That is an analysis because it just, or it is an explanation because it just repeats those words. Instead, what you could say is, this participant is discussing mutual compromise in order to build common ground with patients, something like that. So you have, after the quote, your first sentence is, what does this individual person mean? The next sentence is, how does the experience of this individual person connect to the broader idea of the theme or the the category, whatever the case may be. So you go from explaining that individual person to what is the big picture question here. So you need to have at least 1 to 2 sentences, quote, sentence explaining, sentence analyzing. So these paragraphs shouldn't be any less than like 4 or 5 sentences. That said, you want to tend to have a pretty good proportionality there. So you don't want 6 sentences of introduction and then a quote and then 2 sentences after. You also don't want your explanation to be extremely lengthy. You should be choosing a quote that some of it at least is self-evident, and what you're doing is pointing the reader to the higher level analysis that you've conducted. So keep in mind, if you're writing something and like your bottom section is too long or the top section is too long before or after the quote, you might need to revisit, like, is this the most effective quote? And also, like, am I setting it up the right way? Before I do a worked example, you also want to say across your results or findings section, you want to try and use quotes from a wide range of participants. So depending on the number of participants you have and the number of like data samples or units of data you have, you may not be able to include a quote from every one of 45 participants, but you need to show that you're using a range of perspectives. So we'll have sometimes a star participant and like maybe P1 says brilliant things over and over and over again. Well, you can't use P1 6 times and not use other participants. So you want to be mindful of that. You also want to think about avoiding something that's like a bit of a red herring quote. So you might get a quote that's like really provocative or really interesting, and you're like, I really want to put that in there because I can't believe this person said this to me. But if it's not serving your overall narrative, you can't put it there just as a distraction or just as kind of a shiny object. You have to make sure it's fitting in the overall narrative. You also, if you're reporting 3 themes, you want, say, 1 to 2 quotes in each. You don't want to have one theme with 6 quotes, the next one with 2, and the next one with 2. So thinking about balance across the section is useful as well. I'd say for each theme, you must have a minimum of 1 quote. I think 2 is kind of a nice place to be. Depending on the variations of that theme, or like maybe it's experienced in different ways, it might make sense to have more. But you also shouldn't need 5 or 6 to illustrate one theme. If so, you might need sub-themes or you might need to arrange it differently. But it should take kind of 2 to 3 quotes for the reader to understand what you mean and why you see it that way. So I've got a quote. This is from a published study. And so this was a healthcare professional talking about providing food for patients with low income in a clinic. So we do get stuck on things like how much food do people take? How much do they have? Should we limit it? What does this mean? And at the end of the day, we conclude that this is a food security issue. So this quote is not actually about food. It is about food, but it's not about food. What this quote is about is how the staff and the patients negotiated power or negotiated who gets the decision making around food. And so we're going to write it up with that understanding. So let's say I provided an introduction. Participants discussed how they worked with patients to avoid a paternal model of care and build partnerships in their work. So that's a big picture idea I'm trying to illustrate here. So start with that. Then I've got this participant discussed these dynamics in relation to free food at the clinic. So I told the reader, okay, this big picture idea I just introduced, this quote is going to illustrate that big picture idea. And the context of this is we're talking about food at the clinic. So you know like where this is coming from. This is not somebody talking about lunch with colleagues, like the food is in relation to how the staff and the patients interact. Okay, so we conclude that this is a food security issue. We're going to follow that with our sentence on what does this person mean? Okay, so this is where I'm explaining what the participant said. So this participant explained that the staff decided that patients could make their own decisions about how much food to take, and it did not need to be overseen by the staff. So the it isn't really working here. And food distribution did not need to be overseen by staff. So you want to be as precise as possible, and it may add extra words through here, but saying something like it's like, what exactly am I referring to? So we avoid saying just this illustrates da 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 da, because part of writing results is a very high degree precision, and the reader should always know what you are referring to. So I got my sentence here explaining, and now I'm going to offer the analysis. Okay. So we explain what they mean, then the food sharing was one example. So I'm going from this specific example to the bigger picture concept I'm trying to illustrate. Was one example of how the staff tried to support patients making their own choices, fostering patient autonomy. So connecting with the idea that we want to avoid a paternal model of care, we don't want the staff telling the patients how to live every element of their lives or how to engage with each element of the clinic. They said, you know what? People know when they're hungry. We can trust them to take the food they need to take. We don't need to portion it out or supervise it or anything like that. So further then, the trust that was built around food and letting patients be their own judge of their food needs extended to other parts of the therapeutic relationship. So I'm now illustrating how maybe the food is a pathway to, okay, I let you make your own choices here. Now, how can I support you to make your own choices in other areas of your health? So if I were going on to the next paragraph, it would be something about like building trust was important, because then people could make effective decisions about maybe what methadone dose they needed or something like that. So this is how to write up, foolproof way to write up qualitative findings. Because when somebody reads this, they understand that this quote is not about food. It is about food, but it's not about food. They see how the example of food is part of a bigger picture of what they were trying to achieve in this clinic. And they can also see how you went from this quote to this understanding of trust, autonomy, therapeutic relationship. And so by doing this, at the end of this paragraph, the person reading it says, okay, I know exactly how you got there, what this means, and yes, I am with you. I see where you're going with this, and I see how you are illustrating these ideas, and then on to the next. So that is a foolproof way of writing qualitative findings. And so then you can use that same template and just repeat over and over and over and over again. Now, I'm not suggesting that you do something that seems repetitive. What I'm trying to offer is a structure that can give direction to how you write about those findings so that the focus stays on what your participants are saying and the ideas you're generating, and people aren't getting lost in trying to interpret what everything is about. Because with that quote, if you didn't have effective interpretation, somebody might not get from the idea of food distribution to trust, autonomy, therapeutic relationship. They might just say, well, this is about food. So when you walk them along so that they get to the bigger ideas, they say, ah, yes, I see how this was a small way to engage around these ideas, which led to bigger ways that they could engage in around other clinical issues. So when writing qualitative findings, introduce, quote, explain, analyze. That'll take you all the way. Happy analyzing.